Maria and
Gina.
With your favorite show, Reflect.
And we start with Maria and Gina.
Thank you so much. As always, every Wednesday you're joining us, and they're growing. Gina, our followers are growing.
Yeah.
We're really thankful that and grateful that you take the time to pay attention to what we're saying, because what we're bringing to you is valuable information. We really are very lucky with the guest speakers that we have at our show. So today, Gina?
Okay, today we have Dr. Samant Virk.
Yes.
And he owns MediSprout, which is a telemedicine company. We're going to tell you a little bit about telemedicine and how it can actually help you get the care that you need without going to the doctor's office, right? So first we're going to ask you, we're going to welcome to our show.
Thank you for having me. Appreciate
And he was a last minute thing. He jumped in for us. It was so great today.
Very
perfect.
Tell us a little bit about you and how you got started with all of this.
Yeah, so I'm a physician. I've been practicing for about almost 15 years. And almost 4 years ago, I transitioned out of practice, and now I started my own company, which I'm doing full time. So in my office, I would too often see patients coming in and struggling to families, patients, communities being affected by the cost of healthcare. They couldn't pay for very simple kinds of services that we were offering, and on our end as clinicians, we were trying to squeeze in more patients in less time, fighting to get reimbursement, and not providing the kind of quality care I knew that I was capable of. And so I knew there's got to be a better way for me to help my patients. And I started this company, a telehealth company, where I said, why can't I provide some of the simple things that patients need virtually, the same way that you get virtual help from your bank or order something from Amazon? Why can't I connect with my own patients over video? And when I didn't find a solution that did it for me, that was cost effective, we went out and built our own. It's a video communication, a telehealth company that doctors can sign up for. Two of our missions are to create healthcare that is more cost effective and that provides continuity of care, because there's no better care than from your own doctor. The reality is that all the data shows it. So our solution is free for doctors' offices. Patients pay $4 for a call, and the idea is that patients should go to help from their own doctors when they need it.
Got it.
Yeah, it's actually a great program because we got to see it today, and we are very excited because we are going to try it out here.
Yeah. You know, there's so many people that we hear of, especially like our members, that, you know, they work full time and they can't take off of work to come to the doctor's office. And sometimes it's just for as little as maybe getting their blood pressure medicine filled, but after a certain amount of time, the doctors need to see you to be able to get reimbursed for the visit. But the doctors need to see you, but it could be a face-to-face via
It could be face-to-face or via any device, phones, tablets, computers. And our goal as a company is, we've been seeing patients in our exam rooms for a century now, right? That's just the typical thing. All other sectors in this world have moved on from their traditional ways of providing their services to customers, except for healthcare. I visualize a world where 1/3 of all medical office visits today can be converted into virtual care visits. There's no need for almost 300 million visits every year to take place in person, where people take off from work, like you're mentioning, leaving their children, traveling, transportation. It's unnecessary.
That is true, because I happened to go to an orthopedic doctor this week. It was this week?
Yeah,
last week. Last week. And I had to take off from work, and obviously we are crazy busy. But what I realized is the doctor never examined me. I could have had that visit from my office.
Right. Yeah.
I would have rather had that was.
Yeah.
See, that's the perfect scenario.
Absolutely.
There are so many times, unless you're going, you need to be examined.
A physical or something like that.
Right, and I know there are ways, technology that exists and it's, that being developed where more can be done from the house.
Totally.
But for now, conversations, when you're seeing your doctor, a lot of times, he's not examining you.
No.
He's going over results, or he's creating a plan, or he's looking at the symptoms that you have and trying to figure out what tests to order. Like
Yeah.
I had, he ordered the neck MRI,
Yeah.
but I had to go to his office,
Right.
pay for parking.
Yeah.
Actually, the guy I knew, and he was nice enough and did not charge me. But you would pay $5 for parking.
Yeah.
You pay for gas, and then you take time from work.
Yeah.
Yeah.
So this is.
Yes.
We've actually been exploring telemedicine
Sure.
for a little bit because at Formé, we're very creative. We like to think out of the box, and we definitely like to try new
Awesome.
things.
That's great.
Whatever we can do to lower the cost of care without affecting the quality of care.
Yeah.
Right?
Exactly.
Yeah.
You were going to say something before I interrupted.
Yeah, she interrupted me. But even for employers,
Yes.
to be able to know that their employees don't have to take time off to get their medications or
Absolutely.
to get, and they could do it on their lunch hour.
Yeah.
I mean, you can book an appointment on your lunch hour. It's something for employers to think about, to maybe, look into something like this with companies like us, like insuring your people through us or a membership where we can provide this for them.
Yeah, I think it's just a reimagining of how we provide care. We've really reached a breaking point in healthcare now. We were speaking earlier about how by the time you get to your deductible, you've spent so much money out of pocket.
Right.
And as a clinician, I look at this as patients come in and I say, you know what, if this money was coming to me directly, I mean, I could provide better care and better service to patients if I was getting reimbursed on par with what the insurance companies are making on top of this, that it just doesn't make sense anymore for patients or for clinicians, right? So I think just reimagining with employers, you read about it all the time. They're being devastated by the cost of healthcare and the productivity loss. So if as a local group like Formé is, you can create relationships, and to me it comes back to relationships, but you can create relationships with employers and offer their employees the care they need, whether it's virtually complemented by in-person care. I mean, you can do so much more and provide better care to people.
A lot of small businesses, they're not able to retain employees. I mean, it's a struggle because you're not able to provide health insurance. Or if you're providing health insurance, then the cost to the employees is too much.
Too much, yeah.
I mean,
our people opted out.
We were talking about the fact today when we were talking that the fact between Gina and I, we're almost paying $22,000 a year.
Yeah.
$22,000 a year just in the two of us with a deductible that is $2,500
each.
$2,500.
Yeah.
So I mean, I've been going to the doctor, I've had some medical issues as I'm training for the New York City Marathon, but I mean, I would be the one, I'm paying for that.
Totally.
$2,500 plus $22,000.
It seems that what the insurance companies are doing now, are they creating a platform where your insurance really only covers your catastrophe.
Yes.
It doesn't cover any of your healthcare costs.
Yeah.
Like, unless
But
preventative.
yet the premium
go up.
it keeps going
and
up
so do
and
their
up.
salaries.
Yeah.
The executives are making millions on you.
Their profits keep going up every year after year.
But I like what you had just said.
Yeah.
If you took that $300 to $400 a month that you're paying the insurance company to pay, and cut that in half or a third, and paid your provider on a monthly basis, they could provide the best care for you.
Yeah, I have the statistic, two stats. One is, I'm forgetting the source, but recently an article came out that said employers now, about I think 20 years ago, were paying 14% of their spend was going towards employee health care, and now it's 31%.
Wow.
Right? And second is the average U.S. citizen pays $10,000 a year in healthcare. If you distribute it across the population, not just citizen, the average person, citizen or non, if you took if you took a 10-doctor practice and the normal patient panel being 1,500 to 2,000 patients per clinician, for a practice that'd be almost $200 million. I mean, if you gave a 10-doctor practice $200 million,
they would do all the surgeries and they get everything.
Cover everything with extra
Yeah.
left over for the staff and whatever else you need. So, where is this cost going? It's baffling.
Pockets.
It's in pockets.
It's going in someone's pocket.
But we talk about it all the time. I mean, we call each other the rebels of healthcare because
Rebel rousers.
Love
yeah,
it.
'cause
Yes, I see that.
Rebel rousers.
Yes.
we did a Facebook Live that we invite you to go and look at it
Yeah.
again because we were talking about the broken healthcare system, and we actually were talking about the fact that how people charge, like the hospital charges people that don't have insurance.
Mhm.
700% of Medicare.
Yeah.
And we're like, how is it possible that you accept, let's say $700 for Medicare, but yet if you don't have insurance, you're gonna pay 700%
Of that.
of that 700? I mean, but it exists.
Yeah.
And just so
It
you know,
exists.
people that can't do
It's
percentages, the math is a mammogram should cost you about $100. If you go to the hospital, it's $1,300. So that is 130%.
And by the way, we're not making these numbers up. We actually have patients that this
More than
has
130.
that has happened to.
Yes, yeah.
We had a patient that is the member and went by mistake to a local hospital
Mhm.
and got a bill for $1,300.
We're not making it up.
These are the stories that you see in practice, and after a while, it breaks you. Like you say, how am I doing this and supporting this kind of infrastructure and playing into it? At some point, you know, I personally said I had enough, and luckily I was able to kind of do this. But I think we need innovators, and we need people to start looking for new ways because the fundamentals of healthcare are just broken, right?
Yes.
Totally.
It's sad. It's sad.
The
And
co-
people can't even afford it, so
The co-
they opt out.
They opt out. The costs are healthcare now is the number one cause of bankruptcy in the country. Personal bankruptcy in
Wow.
the country, more than anything. It's what people, and these are people who are ill with, you know, some with terminal diagnoses, and you don't see them, right? Luckily, there's, you know, we live in an area where, you know, we're kind of buffered from that, but across the country, it's devastating. Hospital systems are going bankrupt in communities, and you know, in upstate New York, I know a couple. We really are reaching a breaking point. So we have to come up with innovative strategies. So we made our solution no cost because we believe that medical providers shouldn't have to bear the burden of paying for technology solutions that benefit insurance companies and pharma and the medical legal sectors, right? That's what's happening in our practices. We're bearing the burden of cost for things that we're not seeing the benefit of, right? So we create to be free for doctors, $4 a call for patients to look for a way to create fundamental change.
So just to be clear also, so that's your fee, but you know, you're still using the doctor's time, so there would be
Yes.
a fee associated
Right.
with the call, but it could be a much less of a fee, or you know, pretty relative to what you would have paid if you went to the doctor. But the truth of the matter is, what do you save with time?
Yeah.
You save time. You know, there are waits that can be 2-3 hours sometimes.
Yeah.
That may not be necessary.
Yes.
You know, so your time's very valuable, and you should think about how valuable your time is.
Yeah, no, the time is huge, and you're still getting, and the key is, again, it's getting care from your own clinicians who know you. And I think we get caught up in this world of healthcare now where everybody's talking about AI and blockchain and, you know, all of these technologies to replace kind of the care that a clinician can give you. And I'm a big fan of those technologies, and I think that there's tremendous value, but we're not there yet. And unless we do something to help people on the ground now, you know, those relationships are what we have. And there's plenty of data to show that the difference between getting connected to a doctor or a medical provider that knows you versus one that doesn't, especially for long-term care, that's all the difference in terms of cost and quality.
Yeah, and to be able to manage those chronic patients, that's one area that I really like.
Yeah,
that
absolutely.
you know, you have patients that have chronic conditions, and that it is sometimes hard for them to come in and see the doctor. But if we set them up there in their home and you're able to manage it, I mean, you're saving the entire healthcare system money, but more than less, you're affecting that life and the life of that family.
Yeah.
You know who's recognized that? It's interesting. Somebody just sent me an article today, and I knew this was happening in England, right? They have the National Healthcare Service, the NHS, right? So they're managed by a government association. They just created a relationship with a telehealth company to provide telehealth visits to primary care doctors all across the country because they realize the value. They realize for chronic conditions, for cost, these people need to get connected to their own doctors. And if a whole country, their health service realizes the benefits of this, why are we still the 59th in the world in terms of quality of care? Because we're innovating, but we're really not. We're kind of stuck.
But the truth is, until recently, insurance companies don't even pay for it.
No.
So they
Yes.
they find areas or ways to stop paying you.
Yeah.
And,
yes.
And it's terrible. It's really
And
terrible.
not just that, Gina. The other thing they do is that they pay you differently depending if you're small.
Yeah.
We've talked about
this,
the other day, and it is unfair.
Yes.
It is so unfair that all these doctors that are independent doctors, that they have driven all the doctors out of business and they force doctors to join these huge practices. And is it better care? Is it saving money? I don't know. All I can tell you is that if you go to a larger organization,
it's a mill.
You go,
it's a mill.
yeah,
You get lost in the numbers. You
and not
become a
just that,
number.
but the insurance companies are paying more money,
Right.
because they have better contracts with them.
Yeah.
If you come here, it's costing the insurance a lot less because they're paying us peanuts,
Yeah.
which really it's so unfair.
Yeah. Well, they're not invested in, their interest is to keep things status quo, right? So they have no incentive to change, right? So even when state governments are trying to pass legislation where telehealth can get reimbursed, right? Who's at the forefront of fighting that? It's the insurance companies. They don't want that because their stakes are planted and their profit centers are set, and any threat to that, they're going to fight. And unless we, I see us as having kind of the power in healthcare, the clinicians and people who run medical practices and the patients, right? We just have to reclaim what's ours.
Yeah.
And if we reclaim that, we can then shut others out. But we have to start working together as clinicians and medical organizations, start kind of bonding together and standing up to this, because these denial of payments, right? I was talking to a practice a couple weeks ago, and they said, a few years ago, I felt like they denied 1 out of every 10 payments. Now it seems like they deny 1 out of 6 or 7.
Because they're hoping you don't go after it.
They're hoping you don't go after it.
And they're fraudulent denials.
Yeah, and there's nothing you can do.
And the other thing the insurance companies does is, so you can't go against them. If you get a contract, they don't let you lobby against them.
No.
There's a lobbying clause that says that you can't go against what they're doing.
They're immune.
Yeah.
They've set up the legal framework so that nobody can push whatever their final verdicts are.
And they're licensed to discriminate. They're the only legal entity allowed to discriminate against each and every one of us.
Yeah, they can randomly decide to not offer coverage to certain people or places because they don't have to justify it, right? It's really unfortunate, and they keep pushing the boundaries, right? But it's time to push back, right? I mean, it's time to push back because it is really unsustainable, and none of them have to sit in an exam room and look across the face of a patient, right? Maybe they should. Maybe they should start
think
sitting
that's
in
one
the
of the
offices a bit,
biggest
and
issues.
understanding what the realities are of actually caring for people that are sick.
Yeah.
Because you can't do it anymore. It's
The people that are making the decisions most of them are not doctors.
no.
And
The one denying your claims aren't even doctors.
Yeah.
They are administrative people
Yeah.
denying claims.
And they test your patience, because even when you get that patient where you feel like, I'm going to make sure they get what they need, they will break your will. They will put you on hold, and they'll keep you on the phone, and then they'll pass you on to an appeal, and then you have to go through an appeal with one of their clinicians and spend 20 minutes on the phone with them to get something justified. And then you appeal it again and go to an administrator. Next thing you know, 2 weeks are gone and hours of your time for one case. So they basically just wait until you give up. And there's nothing you can do, right? So again, one of the frustrations of what practices are like. So when you're in your medical office next time, realize there's a lot going on behind the scenes.
A lot.
Where getting paid and getting reimbursed isn't as simple as just like, sending a check. It's pretty complicated.
Can insurance company deny you with a condition?
No. Well, with the ACA now, they were trying to push it back. I don't think it's officially changed yet, but if they've kind of been breaking away the ACA piece by piece. I know that the goal was to completely dismantle it. I don't think it's completely dismantled yet. The pre-existing conditions clause, I believe, is still in place.
Yeah.
But if kind of certain entities have their way, it will be eliminated. So people who have pre-existing conditions can be discriminated against once again, which
that would be
is a
devastating.
basic right,
Yeah.
which will be gone. I believe within the next year will be gone if it isn't already.
I
hope that is not the case, because that is really
it's
devastating.
not fair. It's just not fair.
No, it's not human. It's not humane.
They're not looking at the patient, like you said. They're looking at the bottom line.
They're looking at the bottom line, and
but ironically, the bottom line. I mean, if somebody, because we had a situation with an employee that somebody I know that actually, thank God that law existed, because she lost her job, and as soon as she lost her job, she had cancer. And she had to go through double mastectomy. She had to go to chemotherapy, radiation, horrible other surgeries. It was, imagine.
No,
first of all, it gets to a place that she could not ever have paid those bills.
Right.
So we would have, the tax dollars would have been covering it anyway.
Sure.
So that's not the solution. Not offering people that need insurance. I have to say that Obama, affordable care, we are treated better by the affordable care insurances than the private insurance. Private insurance.
We're looking to drop eventually all the private insurances.
Yep, and we don't even, we say it because
we don't care. We're not getting paid
we
anyway.
don't have much to lose.
We're not getting paid
and
anyway.
that's why in our mind is we're going to figure out a way to provide care to the patients at a reasonable, that is accessible to them.
Yeah,
right?
And also with our, I don't know if we mentioned it to you today, but we started a not-for-profit.
Okay.
So we have a not-for-profit that's called Promise to Aid. We got the verbal approval from the
Awesome.
IRS.
Wow.
And this is going to help people who are uninsured, because you know that we are basing our medical membership on the uninsured. But it's going to be able to give them surgeries.
Wow.
Because if you don't have a life-threatening
Huge.
condition, Medicaid will not cover
Wow.
any of the surgeries. But we have people in our membership alone right now living with pain.
Wow.
So we're going to start this huge campaign, raise a lot of money through grants and fundraising.
That's awesome.
And we're going to start doing having surgeries paid for our members.
It's great. No, you need that. If you're gonna take complete care of people, you need to have those resources in place. And if it can be a model that you can replicate, I mean, there's tons of opportunity.
That is our goal, and it is not easy, to start this mission. We have encountered a million challenges. We've encountered so many challenges that we actually have gotten comfortable.
It's almost you laugh at it now. You're like, what else can come? What else can hit us?
Keeps
But
going.
we're getting so far,
Yeah.
and then you get thrown back because something and 90% of the time it's the insurance companies that are destroying you, and we're trying to figure out a way not to deal with the insurance companies anymore.
Yeah.
Because at this point, our medical membership provides so much for people that don't have insurance that our business could thrive, and we could expand this to so many different places just with the medical membership.
Yeah.
Wow. No, we really believe healthcare is so complicated, right? There's so many levels and structures and entities involved, but we really believe there's a better way. We have so much good care to provide, and there is a way to do it where our practices can thrive and they can be profitable and people can be happy and healthier, right? There is a way to do it, but it takes innovation and it takes thinking out of the box.
We need to work together.
And you need to work together.
And I think the problem that we confront is that we have so many people working against fixing it.
Yes.
What's broken? It's they don't want to fix it because fixing it will have major dollar effect, right? They'll lose a lot of money.
Yes.
And it's going to take a revolution of all the people that are uninsured and all the people that are suffering, like you say, that in the country that's the number one reason for bankruptcy. That's disgusting.
It's disgusting.
It's insane. These are our parents, our children, in our communities, right? They're all around us.
Yeah.
And you don't realize it. And for me, it's technology. In healthcare, the technology that has been created, it's let us down, right? In so many other places in our lives, right? Whether it's ordering something online or getting food delivered or booking a trip, right? It's so easy and seamless. The technology in healthcare, in my practice, when I actually looked at it, it wasn't focused on me, and it wasn't focused on my patients. It wasn't focused on making our lives easier. It actually made our lives harder, right? Our EMR and our scheduling systems, they're actually just glorified billing mechanisms and glorified ways of documentation for medical legal reasons, right? And in the end, they figure out how we can use it, right? So we've kind of taken the opposite approach in how we designed our solution. We said doctors and patients first, it's completely about you. Everything should be simple and easy, connection, getting paid. So it's also rethinking, we view healthcare through this, we're so adjusted, whether you're a patient or a doctor, looking at it through a certain lens of the insurance company or the pharmaceutical view, right? It's about us. And we need to start standing up for that, right? Whether it's with when you're at your doctor's office or with your insurance company. And the technology has to reflect that. That's one thing that we've done.
In your technology, when you call a patient and you said you can can you write in your system?
Yeah.
Or is it you put it into a private, like if I was to write something, a note in the system, your system that I'm in, will that come up when I see the patient again?
Yeah. So you
it's almost like a little EHR system.
It's like a semi-EHR system.
Yeah.
So there are some small notes that you can take, and you can keep it as part of the record.
Right.
You can transfer that into your EMR if you want. We made a strategic decision not to spend a lot of effort integrating with EMRs.
Right.
We just view them as kind of quicksand, if you will. They're not well designed. Clinicians, for the most part, despise them.
Yeah. Terrible.
And we didn't want to kind of hitch our wagon to them because they're just going to pull us down with them.
Right.
So we were trying to be, what's the center of the practice? Is it the documentation? The center of healthcare is, how do I see my patients? That's what healthcare is about for a clinician. I want to see my patients, and I want to talk to them, and I want to offer them advice. That's where healthcare begins. And if we make the center of healthcare the EMR, meaning if my only focus is on documentation and billing, then that's the center of healthcare.
That's what the economy or the healthcare system is making you
driving you do it.
You're making you say, okay, I'm going to sit with you for 3 minutes, and I'm going to spend 20 minutes on the system.
Yeah.
Because I have to report this to be able to get paid for my 3 minutes with you.
Well, the statistic for doctors is the Annals of Internal Medicine did a study in 2016 which showed that doctors now spend 27% of their time actually providing care to their patients. 73% of a doctor's time is now spent doing admin work, notes, EMR, phone calls.
That's terrible.
Not with.
Terrible.
So
I know that.
Maybe another industry, and that's only if you went to work for a day and somebody said you're only going to get paid for 27% of the time that you're here. Who's going to take a job like that? It's just insanity. So what we're saying is we need to start making that 27% more productive and generating revenue opportunities from that other 73%, because it's not sustainable. It is not sustainable. And they're going to keep pushing and pushing the envelope until we push back. So adopting something like telehealth is a way to push back and say, you know what, we're going to do this the way we want. And we've set ours up to be that solution which can derive revenue from the 73% and make the 27% more efficient.
And also give the patient more one-on-one time.
Yes.
Even if it's in by phone, it's still one-on-one time. You're looking at it, you're looking at each other, you're talking about your issues.
Totally.
And and what happens now is that a lot of the times I feel like the MAs have to call you back because the doctors are just trying to get as many patients in as possible.
Yeah, we definitely are asking so much of the doctors. It's incredible.
Yeah,
and they get, it's harder for them to make money. I look at the billing that we have to, billing for a visit, you have no clue.
It's people on the back.
Yeah, it's ridiculous.
Crazy.
But anyway, I'm being told that we have a minute left, and I just want to say, thought-provoking conversations.
Yes.
That's what this is. So I want you guys to think about what we are discussing and join us on this effort to really make a difference in this broken healthcare system.
Be a rebel rouser like us. Let's
Yes.
go. I mean, it takes a village. So
It takes a village.
without the village, they're going to keep controlling all of our lives.
Yeah, you got to do it. You gotta
And
do
it's
something
nice
different.
when we find partners that
Yes.
feel the same way.
And,
Yes.
and look out for us because we're going to be working with Samant for our telemedicine.
Awesome.
Thank you so
Thank
much
you
for
so
joining
much.
us.
Thank you for having me. It's a
Take
pleasure.
care.
Thank you.
Thank you.
Bye.
Bye-bye.
See you next week.
Bye.